Good morning, dear students. Today we discussed about the topic drug dependency and drug addictions and what are the different types and what are the treatment options. Okay, before going our topic, we just discussed about one case. A 50-year-old salesman was admitted to the hospital with acute appendicitis and he has no significant medical history, takes no medication, does not smoke cigarette and has an alcoholic beverage once in a while, and he underwent an uncomplicated appendectomy. On the second hospital day, you find him to be good, agitated and sweaty. His temperature, heart rate and blood pressure are elevated, and a short time later he has a grand mal seizure. Okay, so what is the summary of a case? Is a 50-year-old man. So is a having an withdrawal symptoms from chronic alcohol abuse. So for firstly we controlling the seizure, IV lorazepam for immediate control of seizures. So IV lorazepam administered, then plan to start him on oral chlorodiazepoxide when he is in more stable. Okay, next we come to the learning objectives of our class. This is the what is drug dependency and what are the different types of drug dependencies, physical and psychological dependency, and what is drugs used in dependency. And then we will discuss about the pharmacological treatments of alcohol and nicotine addictions. Then list the common drugs of abuse and their properties. Then adverse effects of the common drugs of abuse, with the vaccines that develop for drug addictions and alcohol abuse. Okay, we'll discuss one by one. That is drug dependency. According to WHO, drug dependency is a state that is a psychic or physical state. This usually result when our body react with a drug. Is a condition where we reach the compulsion to take the drug, and we are continuously taking the drug, and this showing the some psychic and physical effects, and is sometimes to prevent. We are taking the drug continuously, sometimes we are using to prevent the discomfort given by its absence, like that we feel. So we feel that we are taking the drug to avoid the discomfort, and that means we are depend to that drug. These are called as drug dependency. Is a mainly is a psychic and physical stage. Okay, what is habituations and addiction and how is related to dependency? Any relation? Actually, for this WHO first proposed this word habituation, then it's renamed as addiction, then we now is called as drug dependency. So what is habituation and addiction? Habituation, that means if we are continuously using any substance with there's no evidence of tolerance. But in case of dependency, there's a chance of tolerance may be present or absent. And in habituation, that means a desire is not an compulsion. But in dependency, we are continuously use is a compulsion to take the drug. We have the tendency to compulsion to take the drug, and we reach the tolerance level. But in case of this habituation, we have only the desire, not the compulsion. And here need not recur to increase the dose, because he has not reached the tolerance level. If we reach the tolerance level, we need to increase the dose. But in case of habituation, there is no tolerance, there is no compulsion, only desire to taking. So we need not to increase the dose. For example, if you are taking the tea or coffee for regularly, if you are regularly taking for 2 times or 3 times, so it's only the desire, not the compulsion. Without tea or coffee we can live. This is only the desire, not the compulsion. And if we today if I am taking for 2 cups, need not recur for the 3 or 4 cup. The next day we need not to increase the dose. We can feel better with the same amount of coffee. That is only the habits. We can say that is a compulsion, is only the desire. Okay, this is the certain level of psychic dependence, but no physical dependence. So there's no withdrawal symptoms. But in case of addictions, what happens if you are continuously administered a drug or any substance, alcohol, we reach a stage of tolerance. That means if we are using the alcohol continuously, if we started with one peg for this 1 week, 2 week, and we get the pleasure or self satisfaction, but we reach the one stage, we feel the discomfort and we need or we have desire to increase the dose from 2 to 4 or 6. So gradually we increasing the dose and we reach the addiction stage. That is the addiction stage. We are compulsion to take that substance or alcohol, and certain time reached, we are increasing the dose and we reach the addiction level. Okay, so this drug addiction, there's the tendency to increase the dose, and is a self-defining as a drug addict. Is a social effects to the determine of the individuals. Okay, so usually these drugs or alcohol mostly used for this first stage in for experimentation we are using. Then we use reach the second stage, that's the regular use. Then it's the risky stage. Then it reach the dependency stage. Okay, this dependency we can categorize as psychological and physical dependence. Okay, what's the psychological dependence? That means an intense desire to continue to taking the drug, as the patient feel that we are taking the drug for our well-being. So we are the intense desire to continue taking. So the continuous desire to taking the drug, and we feel better when we are taking the drug. This is a psychological dependence. That is psychic or emotional dependence. So this psychic or emotional dependence is the best example is CNS stimulant drug, this amphetamine. This amphetamine, this mainly produce the psychological dependence, but there is very little or there is no absence of physical dependence. The amphetamine abusers are generally teenagers. And this firstly we started with for pleasure and orally taken, that was gradually using the IV injection, and we use gradually increases the doses. This produces the certain withdrawal symptoms like this euphoria, restlessness, insomnia, aggression, psychic state, hallucinations, and repeated uses. If you are repeatedly uses, this produce the long lasting behavior abnormalities, and psychosis may be present. Okay, and in this case this the tolerance may be present, and withdrawal effects are but mild comparing to physical dependence, and mild drug seeking behavior, for examples like cigarette smoking. In case of physical dependence, repeated drug use, this produce the physiological changes in our body, and that makes continuous presence of the drug in the body necessary to maintain the normal function. So we are repeatedly using the drug, and we think that this drug is necessary to maintain our normal function. That is physical dependence. Best examples are alcohol, opioids. These are the best examples of physical dependence. And in physical dependence, withdrawal effects are severe. Mainly these are caused by CNS depressants like opioids, barbiturates. So this high degree of tolerance usually develop with morphine and related opioid categories of drugs when you are using repeatedly. It sometimes causes the pharmacokinetics, is the enhancing the rate of metabolism, but is mainly causes the pharmacodynamics. And this morphine usually produces the psychological and physical dependence. It produces both this psychological and physical dependence, and its liability rate is very high. Some of this recently, this NMD receptor antagonist and nitric oxide synthase inhibitors mainly blocks this morphine tolerance and dependency in animals. So this tolerance and physical dependence usually develop slowly with the pethidine categories. Is tolerance and dependency case is very high degree in case of morphine and this related opioid categories of drugs. Okay. And these are the some drugs is showing the dependency more. This the opioid category showing more dependency. Then alcohol, barbiturates, then psychomotor stimulant, that's the amphetamine, and this nicotine. These are showing the most stronger dependency. And this cannabinoid categories is showing the weak dependency, but most of these studies show that Indians are mostly using this cannabinoid products, as the ganja, charas, like that. Okay. What are the principal treatments of drug dependency? There's hospitalization, substitution therapy. For in case of morphine addiction, methadone on buprenorphine is substituted. And aversion therapy for this alcohol addiction, disulfiram is the best choice. And psychotherapy, then general measures like maintain, nutrition, family support and rehabilitations. Okay, then what are the drugs that's used in alcohol dependency? Usually this naltrexone, nalmefan, acamprose, ondansetron, disulfiram, topiramate. These drugs are mostly used in case of alcohol dependence. This nalmefan is an opioid antagonist. If comparing with this naltrexone, this has some advantages like this greater oral bioavailability, longer duration of action, lack of dose dependent liver toxicity. Okay, how does this drugs acts in the alcohol dependency? This naltrexone and nalmefene both are this opioid antagonists. Usually this alcohol activates dopaminergic pathways in brain. So these drugs are mainly blocking this activation of this pathway. Usually these addictive drugs increase the dopamine levels. Okay, so this naltrexone and nalmefene both blocks the activation of these pathways. Acamprose, this usually alcohol promotes the GABA receptor mediated action and is also inhibits the NMD types of receptors. So this acamprose, this drug mainly modulates the functions of NMDA receptors and modify GABA transmissions. Ondansetron, this mainly this action on the 5-HT receptors. Okay, this normally this alcohol is metabolized by oxidation in liver. So here this two enzymes plays main roles, is alcohol dehydrogenase and aldehyde dehydrogenase. With the help of this alcohol dehydrogenase enzyme, one toxic metabolite acetaldehyde is produced, and in second step with the help of aldehyde dehydrogenase, thus acetate is produced. That is, here these two toxic metabolites are produced, this acetaldehyde and acetate. This disulfiram categories of drugs, this mainly is an aldehyde dehydrogenase inhibitor. So this blocking this second step of this oxidation, alcohol oxidation step, is blocking this production of acetate. So only this so what happened is the acetaldehyde level increases in our body. When this acetaldehyde level increases, show certain manifestations like flushing, headache, nausea. Due to these manifestations, patients hesitate to take the alcohol. This is the main action of disulfiram for chronic alcoholics. This fomepizole is another drug. This is mainly used in case of methanol alcohol poisoning. This is a good alcohol dehydrogenase inhibitor. Okay, this disulfiram, this mainly inhibit the aldehyde dehydrogenase to increase the accumulation of acetaldehyde. When acetaldehyde level increases in our blood level, so what happens? This causes the flushing, headache, palpitations, nausea, vomiting, and decreased blood pressure. So due to these adverse reactions can discourage the impulsive alcohol consumption. These are the some drugs this producing the alcohol produces disulfam like reactions. Some of these drugs are cephalosporin compounds like cefoperazone, moxilactone, and some other drugs like metronidazole, antifungal, this griseoflavine. These are the some important drugs this producing the disulfam like actions. Okay, next we come to what are the important interactions of alcohols. Usually alcohol showing the drug interactions with aspirin and NSAID drugs. This mainly causes the gastric bleeding when taken with alcohol. Alcoholics are usually more prone to paracetamol toxicity due to its enhanced generation of its toxic metabolites. Another drug interaction with in case of acute alcoholism enhances the insulin and sulfonylurea induce hypoglycemia. Another is showing drug interactions with the tolbutamide and phenytoin. This induces the metabolism of these drugs. Alcohols usually synergistic actions with anxiolytic, antidepressants, antihistamines, hypnotics, and opioids. Okay, then what are the medications used in this alcohol withdrawal cases? So the important point that emphasize about the treatment of alcohol withdrawal is that is caused by the removal of CNS depressants, that is alcohol. Most of these CNS depressant drugs are effective, but benzodiazepines categories of drugs have the highest margin of safety and lowest cost. So this class is preferred, and another most important advantages of selection of these benzodiazepine drugs in case of alcohol withdrawal, that is cross tolerance. This occurs one phenomenon, that is cross tolerance. Because of this cross tolerance, these drugs are benzodiazepines categories are more preferred. Both these alcohol and benzodiazepines enhance the effects of GABA, and this results that decrease the overall brain excitability. So this cross reactivity explains why these relatively long acting benzodiazepines like lorazepam, chlorodiazepoxide, this can be substituted for this alcohol in a detoxification process. Before starting our topic, we will discuss one case, that is in a alcohol withdrawal case. On that patient we prescribed this the IV lorazepam for controlling the seizure, and then we administered oral chlorodiazepoxide. Why we are selecting these drugs? Because these benzodiazepines categories, because of higher safety margin and the cross tolerance effects. So these are lorazepam, chlorodiazepam, these long acting benzodiazepines are selected, and this used for this alcohol in detoxification programs. Okay, this cross tolerance usually develops with barbiturates and benzodiazepines categories. Because of this cross tolerance, most commonly used, these benzodiazepines are most commonly used for this treatment of alcohol withdrawal. In our general pharmacology class, we studied about the drug tolerance and different categories of drug tolerance. What are the different categories we studied there? This the natural tolerance, acute tolerance, is cross tolerance. Here this the cross tolerance. Once this tolerance to primary drug develops, these individuals also exhibit cross tolerance to related class of drugs, mostly with morphine and heroin, alcohol and benzodiazepines. These categories of drugs, this usually showing the cross tolerance effects. For example, like for this alcohol addict patient is admitted for surgery, so he need the general anesthesia. Okay, so in for this alcoholic addict patient is already tolerant tolerant, he reached the tolerance stage of this alcohol. Okay, so in case of surgery for general anesthetic administration, we need to increase the dose of this general anesthetics comparing to normal person. Why? Because this alcohol does cross the tolerance of this general anesthetics. So same is a case in case of these benzodiazepines and alcohols. One drug this cross the tolerance of the other drug. Okay, so this mostly benzodiazepines categories are preferred for this alcohol withdrawal. And what are the drugs used for the prevention of alcohol abuse? Usually drugs that are used for alcohol dependence we can use used in case of alcohol abuse also. And these drugs for acute methanol or ethynyl glycol poisoning, ethanol and fomepizole is also used. Fomepizole is a good alcohol dehydrogenase inhibitor. Okay, then what is the treatment of patients with the delirium tremors in alcohol withdrawal cases? Usually high doses of benzodiazepines are used, and antipsychotic medications like haloperidol or onazepan, these drugs are also preferred. In case of patients with alcohol withdrawal seizures, that is benzodiazepines, in the first case was also we administrated this benzodiazepines categories of drugs in case of this patient showing this alcohol withdrawal case. Okay, so these benzodiazepines categories are most preferred for the patients with alcohol withdrawal seizures. Okay, this is the drug abuse, drug addictions and their other treatment options we will discuss on our next video. Okay, thank you.